yesterday, we heard from an elderly woman, Maxine, in pressing need of surgery on both her knees. She's in pain, restricted in her mobility in the meantime. But her appointment yesterday was cancelled and it was rescheduled for September. They didn't say come in next Wednesday, but effectively come back in 6 months and live with the pain. Is that the right way of dealing with the disruption and reprioritising cases whose appointments are cancelled? Well, we had quite a few emails questioning that.
I can't understand why an operation can be postponed for 6 months when the strike is for 4 days. Surely all ops are only delayed by 4 days. Obviously there might be emergencies, but to delay for 6 months doesn't make sense.
And here's another one.
Having lived in the US for 7 years, I greatly appreciate the NHS. But as a former small business owner, I can't imagine a business, small or large, behaving in this way. Couldn't the NHS employ phone operators to ring patients, in business we'd call them clients, to move appointments down a few days? Am I being cynical in thinking having patients kept in pain for months helps the government rather than the doctor's position?
Well, thanks for your emails to pm@bbc.co.uk. We just wanted to investigate a little bit more into this. So I spoke to Layla McCay, Dr. Layla McCay, who's head of policy at the NHS Confederation, and asked her to talk us through what happens behind the scenes.
When an appointment needs to be cancelled or postponed, then the administrative efforts to actually find the next appointment for that person is quite significant. So it's not just a matter of booking them in the next day, because as you can imagine, there are lots of people who are already booked into those slots. So there's a complex juggling process that needs to take place of figuring out whether the doctors or the nurses are available, whether the theatres or the hospital beds are available. Now, on any normal week, that would be pretty difficult to achieve, but right now, when so many have had to be cancelled at one time, that clearly puts extra strain on the system. We don't yet know what number of operations and outpatient appointments, mental health appointments have had to be postponed as a result of the current industrial action. But we do know that so far, leading up to the junior doctors' strike, all the previous strikes have led to 18,000 operations having to be rescheduled, 124,000 outpatient community and mental health appointments. So you can imagine the massive administrative challenge that it is to fit all those people in when most slots are already taken up by more people behind them in that queue. It's hugely challenging.
Understood. And am I to take it that, by and large, the policy is we don't cancel other people's appointments to slot in the ones whose appointments were inevitably cancelled by a day of disruption? So we really are looking for the next available slot rather than pushing them in somewhere and pushing other people down the line as a result.
Well, I can't speak for every single system in the country and how they operate, but the general gist would be that ideally you wouldn't be cancelling somebody whose appointment is already in. Now, that said, across the country, people need to make judgments about patient safety and about urgency and act accordingly. But really the challenge is to fit in everybody who needs to be seen as soon as they can.
Do you see why people do find it, though, difficult to understand why someone who's in pain and, very restricted mobility as a result of a condition just gets shoved at the back of the queue and told to wait 6 months because her appointment was unfortunately just happened to be the day of a day of disruption, a doctor's strike?
I mean, it's incredibly frustrating and it's incredibly bad luck for those people who are affected. I mean, across the whole system, healthcare leaders feel dreadful for everybody who's having to wait a moment longer than they're having to. And we know that when you're expecting to have your appointment and then it is postponed, that can be so stressful and potentially cause all sorts of challenges. But the reality of the situation is that it is really difficult. There isn't lots of spare capacity to slot people in. So they're doing the very, very best. But let's face it, when disruption of this sort happens, this is the sort of results that we do see. At the end of the day, there is going to be disruption and it is going to affect patients. And really, frustrating, sad stories like we're hearing are the human cost of that. All that the NHS leaders can really do is to try hard as possible to get these people seen as soon as they possibly can.
Layla McCay of the NHS Confederation on how appointments are rescheduled.